Developing a national social marketing programme is a very ambitious undertaking. For it to be a success, it's really important that national and local teams work together. Local teams can utilise the brand and the materials developed by the national team and just change them to meet their target audience's needs. But at the same time, the local teams can feed back to the national teams on how things have gone. Time to Change is a great example of where the national and local teams have worked together to increase the impact.
Time to Change is a voluntary sector-led initiative with Mind and Rethink, the charities behind it. And we have really clear outcomes and objectives of this work, which is to reduce discrimination and to destigmatise the issues of mental health. The two major outcomes in Time to Change are about improving public attitudes by 5% over 4 years and reducing discrimination by 5%. Time to Change is actually a social movement, so it's not just the mental health and social care sector who are leading this major social change. It's the private sector, it's the sports sector. Lots of organisations in the voluntary sector are coming behind us because they know they have a role to play in this as well. So our way of engaging organisations who perhaps hadn't had stigma and discrimination or mental health at the top of their agenda was to think about what their responsibilities are as organisations and to talk to them about how we could meet our objectives and their objectives at the same time. And I think one of the ways we've done it is to talk about the commonality of mental health affecting 1 in 4 and it being an issue for all workplaces, and having Mind and Rethink as the partners in Time to Change has helped because of their campaigning and their policy work around those issues.
There's a sort of backbone of support that we can access, and we've had a few delivery group meetings where we've met other projects from around the country, so that's really beneficial to be able to share information and experiences with them and get new ideas and feel that your project is a part of something bigger.
I think the key to the success of this programme has been the first-class quality of the materials that we've used. They produced something called a campaign in a box, and it had everything you possibly need: t-shirts, balloons, pens, coasters, bookmarks, and also having the celebrities signing up. They haven't been able to do anything for us locally, but actually just being on the posters and endorsing it has made a big difference, something that we could never hope to do locally.
What's really important to us is that we don't dilute the message, because we test our campaign creative and we know that it is able to achieve change. But how people use that as a banner is absolutely up to them. And some organisations like primary care trusts, mental health trusts and football clubs will then adapt those materials and put in local celebrities or local people with mental health problems.
The idea was that we put the campaign into areas where people would talk. And it occurred to me quite early on that a lot of people do a lot of talking in the hairdressers. And the strapline we used was that it's okay to talk, so that hairdressers would then carry posters, carry the postcards, so that when people are waiting or when they have their cup of coffee, it would go on the drinks mat and people would then start talking about it. So we produced packs of materials for the hairdressers, and I also prepared a toolkit for anyone who was going out selling the product to hairdressers. And then we ran some training programs so that people would know how to go into the hairdressers, how to address them and so on.
Certainly, I think the national team have used us very well. They recognised an aspect of the work that we were doing, which was quite strong, which was our work around diversity, and they invited us to do a presentation specifically about that at their delivery group meeting, so that we could promote the work that we're doing across Time to Change nationally, so that other projects who were perhaps struggling in that area could take advantage. It's made me realise how powerful a national campaign can be, and that people will make the connection between what you're doing locally and what they're hearing on radio, for example, or seeing on national television.
Hi there. I'm sorry to disappoint you if you were expecting a lunatic with a knife on some sort of rampage. My name is Stuart and I was diagnosed with schizophrenia 12 years ago.
The Department of Health funded a national attitude survey into mental illness is showing a 2.2% improvement across the adult population in England. It's slow, it's gradual, but it's definitely beginning to take a positive turn. But actually what's more significant to us is the viewpoint survey of people with mental health problems, where we've already shown in a year since the baseline that there are 4% more people with mental health problems using mental health services who are living discrimination-free lives. Now that for us is the greatest indicator that public behaviour is changing.